In this video, we'd like to talk about a disease that is often referred to as a rare, but which is estimated to affect hundreds of thousands of people worldwide every year. Pudendal neuralgia. I'll explain to you how to recognize this condition, how to properly diagnose it and what to do about it. So let's start by clarifying what pudendal neuralgia actually is. In medicine, pudendal neuralgia is a chronic pain syndrome in the supply area of the pudendal nerve. This nerve supplies the muscles of the pelvic floor and the skin of the buttocks, genitals and perineum. Neuralgia describes an irritation, and one must clearly distinguish between irritation and a pinching of the nerve. If the nerve is physically squeezed between two bones, for example after a serious accident, you should immediately consult a physician. When the nerve is pinched, however, there is often a very sharp, almost unbearable pain that can be felt around the clock. However, since this physical nerve entrapment rarely occurs and is medically somewhat different, we are now talking about pudendal neuralgia, where the nerve is simply irritated. Pudendal neuralgia causes shooting, burning pain or numbness in the pelvic and genital area. Men often describe genital pain that manifests itself as burning or pulling in the urethra or penis tip, and pain in the perineum can radiate into the testicles. However, women suffer twice as often from pudendal neuralgia as men. They often experience burning and pruritus-like complaints in the vagina, as well as pressure-like, often cramp-like pain in the anus. This is often described as having a golf ball stuck in the anus. In both men and women, the severity of the pain varies depending on the position. When you sit down, the symptoms often get worse. When you lie down or when you sit in the bathroom, the symptoms subside. The pain often disappears overnight when you sleep and then comes back immediately after waking up again. This is a clear sign that the nerve is not pinched, but rather irritated. Alright, now that we have clarified the difference between a pinched nerve and an irritated nerve, what is this nerve and why does it hurt? First of all, you need to know that the pudendal nerve is a very long nerve that starts at the lower lumbar spine and then winds across your pelvis. So the nerve runs from your lower back, around your pelvic bones to the genitals. In men to the tip of the penis and in women to the vulva. So from the lower back, a long nerve runs around it, around your pelvic bones to the genitals, in men to the tip of the penis and in women to the vulva. The nerve is one of the largest nerves in the pelvis and is responsible for many sensitive motor functions. Now imagine that this thick nerve that winds through your pelvis is strongly pressed and irritated at a particular point. What will happen then? Clearly, the nerve sends out a painful stimulus right up the end of the nerve, your genitals. So it's no wonder, for example, that racing cyclists experience this condition particularly frequently. This is because if you press your entire musculature in the sensitive perineal area regularly and for a long time on a small, hard bicycle seat, it is clear that the tissue there will harden at some point, and if you are unlucky, then pressure will be released on the nerve. Incidentally, poor sitting posture over a long period of time can lead to this as much as in surgery or an accident. Also, because we are asked so often, it doesn't matter at all whether you are active in sports, physically super fit, old or young. Damaging the pelvic floor and creating so-called trigger points means your tissue is hardened in one place, and this can happen to anyone, whether you are a marathon runner or a bodybuilder. But how is pudendal neuralgia diagnosed? First, an individual's medical history and physical exam are considered. During a rectal or vaginal exam, your physician may put pressure on the nerve with their finger, which may trigger the pain. An MRI can also help clarify the cause. The nerve conduction velocity of the pudendal nerve can also be examined. This examination is often carried out by a neurologist. He or she can also temporarily numb the nerve by injecting anesthetic with the help of an ultrasound machine. If this reduces the pain, it could indicate pudendal neuralgia. This process of elimination is often what leads to diagnosis. It is estimated that around 4% of all patients who go to the doctor with pain in the genitals, perineum or anus, have pudendal neuralgia. So quite a few. So the next question is, how is it treated? First of all, the physician must determine that the nerve is just irritated by pressure and thus causing pain. If there is no bruising, which can happen after an accident or a surgery, then you can treat pudendal neuralgia relatively well if you do it right. By relaxing the tissue around the nerve, one tries to take pressure off the nerve and to loosen tense tissue and muscles of the pelvis. This is of course not a quick fix, but it is often a successful approach to combating the causes of pudendal neuralgia so that the nerve can be relaxed again and does not cause pain. Unfortunately, in terms of pain relief, there are few medications we can bring to bear because, like most nerve pain, pudendal neuralgia usually does not respond to conventional painkillers. Instead, special pain relievers for neuropathic pain are used. These include, for example, certain drugs that are also used in the treatment of depression or epilepsy. While these medications might not completely eliminate neuropathic pain, they can significantly reduce it. But ultimately, if the nerve is irritated by pressure, no medication will help. The approach must be to physically relieve the nerve of pressure rather than relying on medication that suggests to the brain that everything is fine. Despite this, the use of these strong pain relievers can also help in the short term, especially for those who suffer from very severe pain. These medications must be prescribed by a physician and, if not absolutely necessary, should be avoided, as the side effects can often be devastating and lead to addiction. Surgical treatment is also an option in some cases. In this instance, the nerve is surgically exposed and relieved of external pressure. However, we are convinced that surgery should be always the last resort after other treatments have shown no effect. Your physician can explain this to you in more detail. And finally, I would like to share a story with you about a patient who was in his early 30s and had been suffering from severe genital pain for over 4 years. At night, the pain subsided and he was able to sleep, but during the day he had a strong burning sensation in the urethra, alternating testicle pain and pain in the perineum, and occasionally a feeling of pressure in the anus. He told me that he had already visited 5 urologists, taken tons of painkillers as well as alpha blockers and other things, and nothing had helped. All the tests he had taken had come back negative, and according to the doctor he was completely healthy. And yet his quality of life was so limited that a normal everyday life was almost no longer possible, and there were key signs of depression. And this makes sense. When every physician tells you there's nothing wrong, when medication doesn't help and you still experience sensation of burning and pressure all day. To cut a long story short, today he's completely healed again. And no more pain after sex, no more burning sensation in the urethra. Everything has gone back to how it was before he started experiencing symptoms. But what was the problem? Quite simply, in that case, the man had sat cross-legged in his office job for years and always the right leg over the left, leaning slightly forward. And so in his left inner thigh, directly at the insertion of the pubic bone, a muscle shortening had formed because the muscle was always being pressed. And at the same time, the right gluteal muscle was massively squeezed, which led to a so-called trigger point in both places, a chronic sticking of the muscle tissue. As a result, when standing, walking or lying down, the pelvis was always somewhat twisted, and to the extent that the twisting depressed the pudendal nerve. And how was that fixed? The adhesive in the left inner thigh and pubic bone area in particular could be released again very simply by releasing the trigger points with the pressure technique. The left leg, which previously stood chronically inward, was now parallel to the right leg again, and the pelvis could relax, the pressure was released and the pain is gone. after only about 4 weeks. This is only one practical example, but in this young man's case, it was only a small tension around the pelvis that caused these years of pain. That's crazy, right? So, to briefly summarize, often it is not 100% clear whether symptoms come from pudendal neuralgia or pelvic pain syndrome in general. The pudendal nerve will always play a more or less important role in all cases. If you are still not sure, consult a neurologist. Otherwise, don't focus too rigidly on this nerve, because it is often a mix of various nerves, muscles and tissue areas that are irritated. We, therefore, always regard pudendal neuralgia as a subcategory of pelvic pain syndrome or non-bacterial prostatitis. Even with our patients who are completely healed, it is often difficult to say in retrospect what exactly was the tissue site that caused everything, or at which point was the nerve irritated. In the upcoming videos, we'll look at a holistic therapeutic approach which relieves your pudendal nerve, just like other tissue in and around your pelvis, and calms your nervous system.